Hi everyone, these grapes look delicious, don't they? Yes, today we are going to talk about the grapes in the nose, and they are nasal polyposis. Why are these nasal polyposis said to resemble grapes? Actually, it is not the grapes that you see, the internal part of the grapes. That is what is having the appearance of the polyp. Okay, and yes, now you can understand why it is called so. If you are taking the outer covering of the grape, usually we eat it just like that, right? Instead of that, if you care enough to look for the internal part of the grape, then you will understand why the polyposis is said to be similar to the grape. Yes, it looks exactly like the grape if you are caring to do so. And today we are going to talk about nasal polyposis. The word meaning of polyp is multi-footed. Okay, it comes from the Greek word which means multi-footed. And what are these polyps? Polyps are actually the edematous mucosa protruding out. Okay, the edematous mucosa of paranasal sinus. It is protruding out to form the polyp. Okay, and yes, traditionally we had been dividing the nasal polyps into two, right? That is, ethmoidal polyps when it is seen as multiple polyps, because ethmoidal air cells are multiple in number, right? And androconal polyp when it is seen as coming as a single polyp coming from the maxillary antrum. That is what is meant by androconal polyp. This is how we used to traditionally classify, but with the advent of endoscopes, everything changed. Okay, now we have a better understanding of everything. Okay, now the entire thing where you learn like the ethmoidal polyp is due to allergy, androconal polyp is due to infection, all those things are now we have understood. You can't just generalize like that. Ethmoidal polyp, what we mean by ethmoidal polyp is actually a part of chronic rhinosinusitis, and that is why it is known as chronic rhinosinusitis with polyposis. We have already learned about chronic rhinosinusitis, right? And yes, when sinusitis is occurring for more than 12 weeks, that is what is meant by chronic rhinosinusitis. And in that case, when there is no polyps, that is what is meant by chronic rhinosinusitis without polyposis. Now, when you are having polyp along with it, that is what is meant by chronic rhinosinusitis with polyposis. And when you mean like that, it is usually the ethmoidal polyp that is seen, but along with the ethmoidal polyp, there can be a maxillary polyp or a sphenoid polyp along with that. Okay, that may be present. And yes, in chronic rhinosinusitis with polyposis, there will be multiple polyps seen. And this androconal polyp is again considered as a separate entity. Okay, and we'll be coming to it later on. For now, we will be learning about what are the different causes of this polyp formation. Which is the site of this polyp formation? It is seen in the area of the middle meatus. Okay, in the middle meatus area, which I told you it is very congested, right? In the middle meatus, you have the hiatus semilunaris, the bulla ethmoidalis, the uncinate process. All of them are cramped together, and what happens there is that whenever there is inflammation, okay, whenever there is inflammation, and this inflammation can be due to either an infective etiology or an allergic etiology. Okay, so it can be broadly classified as infectious or allergic, or it could be classified as allergic or non-allergic. Okay, among non-allergic includes infection or some chemical thing which is causing an inflammation. Okay, whatever thing, when there is inflammation and that results in edema of middle meatus, what happens is that there is reduction in the surface area of the middle meatus area, and because of that, what happens, you know that the air currents are going through this area when you are inhaling, right? Most of the air currents are going through the middle meatus area. When you are inspiring without any effort, it will go only through that area, and because of that, what happens is that when the air current is going through that constricted area, and because of the area into velocity being a constant, and according to the Bernoulli's theorem, what happens is that there is a pressure drop occurring in that area. Okay, and that pressure drop is what is causing the polyp formation because the mucosa is getting sucked. Okay, so the basic etiology is inflammation, and this inflammation in this area is what is causing edema, and this is due to allergic and non-allergic etiology, and among non-allergy it could be due to infection. Okay. Finally, there should be inflammation, okay, for this polyp formation to occur. And yes, I told you the major cause of this to occur is Bernoulli's phenomenon. As you can see here, when air is forced in between the balloons, what is happening? Between the balloons the area is less, right, and because of that the velocity is increasing in that area, and what is occurring there? There is a sudden pressure drop occurring, and because of the pressure drop the balloons are getting sucked together. Similarly, the mucosa of the various paranasal sinuses like the maxillary sinus, the ethmoid sinus, all these will get sucked because of the pressure drop, and that is what is known as the Bernoulli's theorem. The Bernoulli's theorem means that there is a pressure drop occurring in an area of decreased in an area which is decreased in a constricted area, and because of that there will be a pressure drop occurring in that area, and because of that the various mucosa of the paranasal sinus is getting sucked in, and that is what is causing the protruded mucosa, and that is resulting in the formation of nasal polyp. So, basic pathophysiology is in Bernoulli's theorem or the Bernoulli's phenomenon, and along with the Bernoulli's phenomenon you have the inflammation occurring, and so edema in the middle meatus is occurring, and that is what is resulting in the polyp formation. Now, why does this edema have to occur in middle meatus in the first place? I told you it could be due to an allergic etiology or non-allergic etiology. Now, initially I told you the all other polyps were classified as ethmoidal polyps, right, and during that period it was said that it was due to allergy, but now it is said to be multifactorial, not just allergy, a lot of factors, but again the most important factor is allergy. Okay, type 1 hypersensitivity, okay, type 1 hypersensitivity and allergic rhinitis. Okay, so when you are having a allergic rhinitis, there is high chance that you can get a nasal polyposis due to the type 1 hypersensitivity mediated inflammation occurring in the area, and because of the inflammation it can result in edema in the area of middle meatus. Okay, edema in the area of middle meatus. Now, I will be initially talking about the causes of the bilateral nasal polyposis. Okay, because there are certain causes which are actually causing a systemic increase in inflammation. Okay, and that includes the allergic rhinitis and bronchial asthma, and because of that there is a polyp formation which will be bilateral, right. So, in adults the first cause that you have to remember that result in bilateral nasal polyposis is allergic rhinitis. Now, what is the next cause that you have to remember? If the patient is having a aspirin hypersensitivity, okay, that is when he is taking aspirin, there is sudden inflammatory changes, that is sudden type 1 hypersensitivity changes, like the patient will suddenly gasp for breath, there will be wheeze, bilateral wheeze occurring, and there will be sneezing episodes. All those things will occur when you are taking aspirin. That is what is meant by aspirin hypersensitivity. Along with that, there will be history of bronchial asthma, and that is what is meant by Samter's triad. Okay, this is Samuel Tarly, right? If you have watched Game of Thrones, you will remember him. Okay, but I am not talking about Samuel Tarly, I am talking about Samter's triad. Okay, Samter's triad. Now, what is the Samter's triad? The Samter's triad includes the bronchial asthma, aspirin hypersensitivity, along with nasal polyposis. Okay, so the Samter's triad, which is nowadays known as aspirin exacerbated respiratory disease or AERD. Okay, aspirin exacerbated respiratory disease or AERD. It is the same as Samter's triad. Okay, if you are asked AERD, don't get confused, okay, it is none other than Samter's triad. And here what is happening, there will be nasal polyposis, of course I am talking about nasal polyposis, right, and then you are having bronchial asthma, okay, bronchial asthma will be present, and along with that what else do you have? You have aspirin hypersensitivity. Okay, this is one condition which has got more than 80% association with nasal polyposis. Okay, more than 80% association is seen with nasal polyposis. That is, whenever you are having an AERD, you are having more than 80% chance of finding bilateral nasal polyposis, and along with that you will also have bronchial asthma. Okay, bronchial asthma. So that's about AERD or Samter's triad. Now what else you have to remember? I told you bronchial asthma can occur, right? Yes, but bronchial asthma doesn't mean it is just AERD. It can occur along with another condition, and that condition is typically associated with a multivessel disease. Okay, this disease is more of likely to involve the medium size and small size blood vessels, and along with that it is resulting in various other problems like myocarditis, renal failure. All those things can happen along with that, and along with that if you are looking at the blood picture, there will be more than 10% eosinophilia, and that is what is meant by the Churg-Strauss syndrome. And whose picture did I show you? I showed you the picture of Andrew Strauss, the former English cricket captain. Okay, he had actually taken a century in his maiden match itself, and yes, Churg-Strauss syndrome is nowadays known as you know about granulomatosis with polyangiitis, right, GPA, which is Wegener's granulomatosis. Similarly, Churg-Strauss syndrome is known as eosinophilic granulomatosis with polyangiitis. Okay, here what is happening? There is vasculitis happening. Okay, medium and small size vasculitis is happening, and apart from that, what do you see? You will be seeing more than 10% eosinophilia. More than 10% eosinophils will be seen in the peripheral smear. Because of the vasculitis, there will be multi-system involvement in the form of kidney involvement, that is renal failure may be present. Patient may be having peripheral neuropathy. Okay, neuropathy may be present. Myocarditis due to heart involvement can occur. Okay, and I already told you lower respiratory tract can also be involved in the form of bronchial asthma, and of course upper respiratory tract is also involved, and there will be vasculitis along with granuloma formation, and that is what is meant by the Churg-Strauss syndrome, which has to be suspected in a patient who is about the adult age and he is having asthma along with multi-system involvement, and when you do a peripheral smear there will be eosinophilia which is more than 10%. Okay, and now the Churg-Strauss syndrome is known as EGPA. Okay, so that's Andrew Strauss, one name to remember, the Churg-Strauss syndrome, right? So coming to the next condition which is seen as bilateral polyposis in adulthood is Young syndrome. Okay, why did I keep Tom Cruise picture here? Because this Tom Cruise looks very young, right? Even at this age he is very young and agile, right? And that is why I kept this picture. And so Young syndrome is one condition which is associated with bilateral nasal polyposis, and yes, it is presenting at about 30 to 40 years of age. And how will the patient present? The patient again will be having the features of polyposis. Along with that there will be bronchiectasis. Okay, bronchiectasis will be present, and there will be azoospermia. Okay, azoospermia. Okay, and bronchiectasis. So that's about Young syndrome. And Young syndrome you have to suspect in an impotent male who is about 30 years of age, and this person will give history of bronchiectasis, that is the patient will be having copious amount of sputum, okay, and multiple episodes of lower respiratory tract infection, okay, and along with that the patient will be having nasal polyposis. And what else the patient will be having? The patient will have azoospermia, and that can result in impotency, okay. So Young syndrome is also seen as bilateral polyposis in adults, okay. Now instead of in adults, if bilateral polyposis is seen in children, what is the first diagnosis that has to come to your mind? It is cystic fibrosis, okay. Cystic fibrosis occur due to the CFTR membrane mutation, right? CFTR gene mutation, and this gene mutation, what happens in this gene mutation, the chloride channel is getting mutated, and because of that there is sodium and chloride accumulation along with the mucous substances getting accumulated, and that is why it is also known as mucoviscidosis. You will be learning in detail about this condition in your pediatrics as well as general medicine, right? And it is a systemic condition that can result in pancreatitis, okay, and various other conditions. But from the ENT point of view, it results in chronic rhinosinusitis along with polyp formation, okay. And so it is very important that you know this condition, that is cystic fibrosis. Cystic fibrosis presents as bilateral polyps in infants, okay, and this is also known as mucoviscidosis. Because of the mucus, thick mucus will be present because of the accumulation of sodium and chloride, and it is occurring due to the CFTR gene mutation, okay, which code for the chloride channel. Now coming to another condition which presents as bilateral polyposis in children, it's not seen in infants, it is more of about after infancy, okay.